Welcome to the Two-Rescuer BLS for Children. In this video, we will discuss Two-Rescuer BLS for children, that is age 1 to puberty. You'll see that the process of one rescuer and Two-Rescuer BLS in children is very similar. Now, let's review the Two-Rescuer BLS process for children. If you are not alone with the child at the scene, do the following. Tap and talk loudly at the child to determine if they are responsive. If the child does not respond and is not breathing, or if only gasping, have the second rescuer call 911 EMS and get an AED. The ILCOR emphasizes that cell phones are available everywhere now, and most have a built-in speakerphone, so you or the second rescuer can call 911 EMS without leaving the scene. Assess for breathing while simultaneously checking for the child's carotid pulse, on the side of the neck, or femoral pulse, on the inner thigh and the crease between their leg and groin, for 5 but no more than 10 seconds. If you cannot feel a pulse or if you are unsure, begin CPR by doing 15 compressions followed by 2 breaths. If you can feel a pulse but the pulse rate is less than 60 beats per minute, you should begin CPR. This rate is too slow for a child. When the second rescuer returns, begin doing CPR by performing 15 compressions by one rescuer, and 2 breaths by the second rescuer. Use and follow AED prompts when available while continuing CPR until EMS arrives, or until the child's condition normalizes. This concludes our lesson on Two-Rescuer BLS for children. Next, we will review child ventilation.